Hi, everyone. Scott Nicholson with the Judy Nicholson Kidney Cancer Foundation. And today I'm real excited to have Marc McDowell with us. He's a clinical social worker with Moffitt Cancer Center, and he's here to discuss the financial distress that can come with cancer. Thank you so much, Marc, for joining us. How are you today?
I'm doing real well. Thanks. Glad to be with you, Scott.
We're glad to have you. And for anyone that just joined us or is new to this format, we'd like to keep this as an open conversation. So if you have any questions throughout the presentation, Marc has been generous enough to just bring them forward, and we'll make sure that we get those answered before the end of the conversation today. So without further ado, why don't you take us away, Marc?
Okay, great. Well, thanks a lot, Scott. Thanks for having me today. I'm really glad to be here. When Linda with the foundation asked me about this, this is something I've worked at for quite some time, worked with a lot of patients with, but it's funny, I didn't quite realize once I started digging into this about how complicated things have become as far as financial issues around cancer treatment. So I feel like in this 45 minutes or so, I'm kind of giving the history of the world, basically, within that 45 minutes. There's a lot of information. Let's see here. And I just want to start with a few just general points. I tend to be somebody that I try to fit a lot of needs. And the one thing with financial issues, and this just sort of brought this really back home to me, is that financial issues can be very complicated. You know, they're very individual and they can be very frustrating. Troubleshooting financial issues can be an exercise in patience. And I really get that from my patients. And for me, this was an opportunity to kind of deep dive and kind of rethink and try to just sum up what I know to teach it maybe a little more succinctly. And this is complicated stuff, unfortunately. There's no one size that fits all. Mastering financial issues will require a great deal of homework and networking skills. I wish that I could give you something that in your situation you could pick up, use, and then just set to the side. What this class is more designed to do is to kind of give you a sense of what the landscape looks like. Each person really has to look at their own individual situation, what their insurances are, what their resources are, who the providers are that they're working with. There are some generic, general uniform things that happen, but there's a lot of things that are differentiated as well. So it's almost like if you are encountering financial issues with cancer treatment, it does become at least a part-time job, unfortunately. And sometimes for some people, it becomes a full-time job, which is really, really challenging and difficult. My object here is to try to educate you as much as possible that I can at least give you some compass to use as you go forward to at least kind of understand the landscape and kind of understand what questions to ask, what potential pitfalls there are, and you can kind of work from there. What's nice is this is being recorded. You can access it again. I'm also going to make my PowerPoint available to Scott so that you can actually look at some of the lists and some of the strategies that I've put here. So you can write down what you need to write down, but rest assured you'll be able to refer back to what I'm putting out. And another thing I'd like to let people know is that more than once, you'll likely receive bad information or out-of-date information. And as you're making plans, you have to make more adjustments. Another thing, Google is both the best and the worst way to search for resources. What is really unfortunate at this point is that if you look at social service directories, sadly, I use Google probably a good 80% of the time. It seems to be, but I also have an educated way of looking at discarding what's bad. And that's one of the things is how do I teach that to someone else? It's challenging. So we're going to do the best we can do here. I do want to give one shout out to Triage Cancer. And if you write anything down about this presentation, honestly, hands down, this was the best site. And I've used them for a long time. But when I was looking at kind of summing things up for this presentation, I kind of went back to them and really realized how much they've grown and how much they provide in their website. They have a law and a finance arm that they've got a lot of people contributing a lot of good information. And I really like the way that If you're looking for individualized information and anything that I refer to in this presentation, you can find a little more on this website. So I highly recommend them. They seem to be very neutral. They're not trying to sell you anything. They're just putting out a lot of good information in a pretty concise way. I just want to start with a few things about bankruptcy. This is the not so fun facts that, financial issues are real issues. And this has been going back quite some time that I've dealt. I've been actually a social worker since 1992. And over the years, things have changed. But one thing that has not changed is that financially, people can take real hits when they have medical expenses, unfortunately. And still, they're talking about 60% of US adults have had medical debt at some point in their lives. 70% of Americans with medical bills have had to cut their food expenses to avoid bankruptcy. 2/3 of all personal bankruptcies are due to medical bills. It's interesting in the statistics. Unfortunately, this has, I think, become a little politicized. There's different perspectives on how many personal bankruptcies are actually influenced by medicine. You're going to find a range if you just do a general search out there. I'm staying with the 2/3. I know it's a high number. It may not be quite 2/3, but I know it's significant. And I know I see them on a pretty regular basis when I see people very engaged in treatment. Unfortunately, this is a reality. Stats that I have, 20% of medical bankruptcy filers are in the 55 or above age group. And more than half who file for medical bankruptcy cite the hospital bills as a big part of the billing issues and billing nightmare that they've had as far as financial. This is another good quick list. I'm wanting to kind of set the landscape, and these are common treatment related expenses. If you don't have to jot everything down here, you'll have this later. But it just kind of gives you a sense that if you're early in this, it's things to look out for. If you're in this, most likely a lot of these things will actually register with you, that you've already run into them. But I think once again, it's good to have your eyes open so that you're looking as you're moving forward, where are opportunities to kind of economize. And I have this in a later slide, and I should actually start with this. You have to be a consumer, a goods consumer. You are looking at the finances. You are looking at what option you have and looking at the financial aspect of options of treatment, comparing things on a financial standpoint as well as a effectiveness standpoint. It's just another scale that you want to bring into things that you want to really consider. So expenses, deductibles, co-payments, co-insurance amounts are things to start paying attention to. Comfort for cosmetic side effects, wigs, makeup, prosthetics, specialty clothing, things like that. That's something you can negotiate a little bit, but it's something that may be an expense to kind of pay attention to. Caregiving costs. If I have some people in Florida, we have a lot of families that all the rest of the families out of the area. And sometimes caregiving costs, if it's just a couple down here, they may be looking at that expense, potentially needing to hire private duty. What's interesting as far as states go, I know we have people from a lot of different states. Florida, we have sunshine, but if you compare Florida with New York or California, the cost of social services or the amount of social services they provide, New York, California on the upper end of the scale, Florida is kind of at the bottom, probably the last 2 or 3 as far as states, as far as social spending. So as far as caregiving, there's not a lot of subsidized assistance out there. And that really isn't just caregiving, but across the spectrum for both people over 65 and people who are lower income. There's just not a lot of subsidized services. So that can be expensive. Long-term or home health costs, long-term care insurance, if people are looking at that, very, very expensive. And home health, once again, can be expensive as well. Psychosocial care, counseling, not a lot of subsidized services for that down here as well. We do have some services through we have a behavioral medicine wing, which is we're really fortunate to have, but that can be expensive just depending on what's going on. Complementary therapies that might ease the cancer experience, those can be expensive. Transportation costs Florida is a very long state. We happen to be an NCI at Moffitt that a lot of people are traveling from quite a long distance to get to us. And that can be an issue, especially now that gas has gone up as much as it has. It's challenging. Also, lodging costs. A lot of these people are coming in and they're needing to stay a couple of days because driving back and forth in one day is a little more difficult, especially if you're not feeling well. And also potentially childcare expenses. So this is just kind of a beginning sheet, and I'm sure there are many other things that could be added, but it just gives you a sense of, once again, the landscape. What are expenses that I'm already running into, or I may potentially run into as I'm strategizing and working on my cancer experience. Potential contacts to discuss your expenses with. Another layer of this landscape. People to ask questions. When you're navigating the financial realm, networking is really important. And once again, I mentioned this earlier in my first slide. You're going to be talking to people, you're going to be getting sometimes bad information and sometimes old information about what might be out there as far as available resources. And so it's a matter of trying to develop a little ability to discern and scrutinize what you're being told, and kind of knowing if something doesn't quite sound right, you might need to determine another source. So contacts with your physicians, one thing that I think is really important to be aware of that most people may not realize is that when a physician orders a test or orders a treatment, it goes through a pre-authorization process. In our hospital, patients seen in clinic, the doctor writes the order, it goes to a pre-auth department that looks at what are the medical benefits. Probably a good example is a medication. And a lot of people, if you've had any experience so far with a cancer experience, you know that you may have been prescribed a medication or for inpatient treatment or outpatient treatment or home treatment that may just be very prohibitive cost-wise. So what you really need to do is doctor writes the order, it goes to your insurance, they come back, they say it's going to cost you $1,500 a month, and that's not going to be something you can afford. Please, by all means, feed back to the physician. Often the physician will find out, but it may not be clear to them. You are completely within your rights to really go back to it and say, hey, I'm being told this is really expensive. Is there an alternative to what you prescribed? In my clinic, that happens almost every day. And that is something that we try to work with. And so, medication is just one example, but there are a lot of these other treatments that they may recommend that just the insurance coverage isn't there. And you're within your rights to ask to make changes. So that's a great example with doctors. But also you're talking with nurses about things, about what's going on. Nurses, honestly, in my clinic, often when I need to be involved, they may be the first person that a patient is talking to. And we've kind of got it all worked out that they know when to let me come in if there's a resource issue or a psychosocial issue. That's the way we collaborate. Also, medical social workers are a great resource. Some hospitals, there's only a few of them, and they may be set up to only perform certain tasks. Their range may be narrower. I'm blessed to work in an organization that has over 40 social workers, and the size of an organization this large, it's very unusual. So we're able to really provide a wider range of services, and not every hospital has that, but it's good to ask to see if you can get a little bit of time. And if you can get an email, that's almost even better for a social worker that's understaffed in a hospital that just doesn't have a lot of them. They can communicate and actually provide information to you, maybe a little easier. Medical casework managers work right along with them. Typically, they work more in an inpatient realm, but they're once again a great resource. Your insurance case managers, a lot of the insurances, particularly a lot of the Medicare Advantage, Medicare replacement programs, insurance policies, they are used more and more are employing insurance case managers. They're usually nurses, but that person, if you realize you're starting to get into more claims because of a ramped up treatment process and your treatment is increasing, often the insurance may identify you as all of a sudden you're utilizing a lot more benefit, and they may actually assign an insurance case manager to you. But if they don't, ask for one, because what that person can do is that's another person to help you navigate the insurance. And it may be really a real godsend to you to help you kind of look at costs, look at the overall plan, identify any problems in billing. If something was ordered, then it was canceled, but you're still charged for it. There are things that the insurance case manager can really help you with. Navigators we're using, we at our organization only have a few of them, but a lot of times they're more on the front end, and they're talking to you about kind of going through any potential barriers to getting to treatment. They're going to be asking about, the distance you live away, transportation going to be a problem. How's your support system? So they're also a good place that, if anything, just having the conversation sort of jogs your mind to start thinking in terms of what are the things, okay, if I don't need it today, what might I need later? So all of these conversations could be really useful. Hospital billing department, very important. What has happened in our organization is I've been doing social work in hospitals for a long time. In the past, we had a broader range of financial services that we provided. What we have done now is our billing department actually has a special area for people who are having problems with copays, having problems with their coverage, having problems come in potentially uninsured. They have now hired staff that are specialized to handle those problems. So in the past, a lot of times get calls, hey, I need to talk to the social worker because I don't have insurance. Well, it's now this other entity within our organization that's managing those things. A lot of hospitals are now looking at the reality that people are running into financial issues, and they're staffing for that. So that's just another, keep that one on your radar as well. There are out in the community patient advocacy organizations. Judy Nicholson is an advocacy organization, but I'm going to bring up a list a little bit later of some other advocacy organizations. American Cancer Society is a big one. Triage Cancer is a big one, which I mentioned them already. So there are all these things that may be helpful to you out there, and you may find local advocacy organizations as well as national ones. So once again, that kind of comes back to Google searching and kind of discerning amidst what's useful and what's not. If you're employed, your human resources department also can be very, very helpful, especially if you run into billing issues that seem like they might be more of a systems issue. Often a human resources department may have contracted with an insurance to come in, and they're providing insurance to the employees without realizing that there are some problems with the system that comes along with it. And I've had numerous times where people have had some kind of issue with their insurance, and the human resources person was able to get involved and to maybe look at some glitch in billing or some glitch in service delivery, or a glitch, several types of glitches. It's also a good idea to talk to the insurance company as well. If you don't have the insurance case manager, just developing a relationship. It's almost like learning a skill. How do you talk to the insurance company? You're looking at your bills, and you're kind of using those people as a resource so that you can kind of negotiate a lot of information. For problems, state to state, a state insurance commissioner, they all have state insurance commissioners. They have varying degrees of involvement with patients. To be honest with you, state to state, there can be real differences. But ideally, they're there for any kinds of major problems with your insurance. They're there to lodge complaints. Some of them are more active than others as far as responding to those complaints, particularly appeals that can be initiated, an appeal that's external to the insurance company. State by state, that's different. So that is something to keep on your mind. Whatever state you're in, do a Google search for the state insurance commissioner and kind of have that in your back pocket as a potential resource. Also really suggest spiritual advisors and community leaders. A lot of people who are having medical issues do tend to gravitate towards spiritual advisors and community leaders. So actually I'm sure maybe they realize it to a point, but they sort of become experts on what's available local, especially members of churches. people who are available to help people, do things as far as maybe transportation to the hospital, sitting with patients, helping families. So all of those things are kind of out there. Keep those in mind as well. So what we're doing is, once again, trying to set the landscape of potential people that may be allies for you to touch base with. And it's just kind of good to kind of know who are people I might be able to help with. And really, I guess is a good point that I want to instill here too, is that you realize you're not alone. There's a lot of people, unfortunately, on the same track, on the same path, maybe different dynamics, but under the same stresses, having the same problems. And so our society is kind of adapting to that, and it adapts in different ways. I do think there are more resources than there have been in the past, but it's still challenging. But it is good to know that you're not the only one out there. I also wanted to mention, there's a lot of caregiver support groups and patient support groups also. I didn't put that on here. Something to keep in mind too for the psychosocial end of it, but also a lot of times that helps with resources. People compare notes and can help each other as well. So sources of financial assistance for people with cancer. This is kind of my big list. And this is how I really determined I was going to help you the most in the time frame that I had, trying to provide as much information as possible. This is kind of a breakdown for me, looking at the landscape of what's out there. These are the actual sources of assistance broken up. These are the categories that I felt made the most sense. Triage cancer did help me a little bit with them, but I did make some modifications. So what I'm going to do for the remainder of the presentation is we're going to kind of go source by source, talking about these sources that are out there. And I wish I could say, okay, you live in Iowa, okay, you live in New Mexico, okay, you live in Connecticut, and I can tell you who's available. I can't always tell you who's available. I'll be able to tell you a few national advocacy and charitable foundations that are out there that are helpful, and they're there for you to access. But there's a lot happening locally as well. And what I'm trying to do is kind of load you up with particularly a lot of search phrases to use to actually do your own search and kind of individualize this to yourself. It just gets you going in the right direction, trying to give you that landscape so that you can kind of have a broad picture so things don't look quite so chaotic. You can kind of start identifying where to apply for help and where to put your energy. So I'm going to start with personal financial planning, and this is probably a little intuitive. And the other thing is I did organize these into a big bang. This is looking at your personal finances, the overall picture. This is kind of a big strategy, and this is a big dollar strategy as well, because you're really looking at your whole financial being, yourself, your family, and you're really looking at, if you've all of a sudden been diagnosed with a cancer, what you're getting is, are you going to be are you potentially going to lose income? Are you going to be able to work? Do you have this work disability? Are you going to potentially not be able to continue working and you're going to have a loss of income? The other thing is are you in a situation now with your illness where you're going to all of a sudden start taking on debt? And these are things to kind of start thinking about early in this, about how things are going. What's unfortunate about insurances in particular, which will be the next category, is that you sometimes don't really notice the holes in coverage until you start using it, because on paper, everything looks good and great until you start getting into the actual executing, and the plan, and start using the benefit, and then you start realizing the limits to the benefit. But anyways, on a personal financial planning, you're looking at kind of the overall picture of your finances. Can you take a loss of income? If you have a loss of income, are there resources? I'll be talking about that later, long-term disability through work, short-term disability through work, whether or not you need to look at potentially disability, Social Security disability. We'll talk about that a little later. But you're also looking about what your resources are, getting advice from a financial planner, potentially. There's a lot of people with ARP, and there's investment management companies that are out there. Once again, there are a lot of people in this situation with medical issues that they're looking at structuring their finances in such a way that they can take less of a hit and try to take advantage of everything that they possibly can. One thing that's a big thing is with, the fact that if you do start taking on a lot of unreimbursed medical expenses, if they exceed 7.5% of your adjusted gross income, then that's something that an accountant can work with you on. And that was last year's statistics, last year's numbers. So those are the kinds of things that you're kind of looking at it from a big picture strategic position. How do you protect yourself financially with what may come? So health insurance is the next big category, and health insurance is honestly the biggest help of everything. It's going to be dollar for dollar the one thing in your life, if you're sick, that's going to help you the most as far as financially. So it's something that we're going to talk about this a little bit more as far as really looking at how to use your health insurance. Once again, and I'm guilty of it as well, my wife is much better as far as looking at all the details of the health insurance. I typically, have been pretty healthy and haven't really, even though I'm working with people running through this, when I apply it to myself, I'm not always really good about knowing all the nuances and all the little pieces and ways that I can save money and ways I can do certain things more tailored to my individual needs. It's something that's important because it's really, this is the one area where you can save yourself the most money is by having the best insurance that fits the needs that you have. So there are employer-sponsored, the big insurance companies that are part of large and small businesses. There are also out there through the marketplace in particular, that's been the most notable addition over the last 10 years is the individually purchased plans that are out there. There's also the government-sponsored programs, Medicare replacement policies like the Advantage plans, the Medicare HMOs, that are things that are instruments that are replacing Medicare. They're all out there, government sponsored, and also Medicaid. And I'll talk a little bit more about those later. I'm realizing I didn't talk as much about Medicare. One thing real quickly about Medicare, if you're in a situation where you have straight Medicare, the traditional Medicare, and you only have A and B and you don't have a supplement, that you could take a real hit if you get into a medical issue. And I do run into that with patients. One quick thought is if you're in that category is assessing whether, it depends on whether you're on a fixed income, what your assets are, but there's always a possibility that you could apply for Medicaid as a secondary. It's something worth thinking about because it would cover that 20%, and that 20% adds up really quickly if you're getting a lot of treatment. What people with Medicare A and B are, there's a lot of energy going into taking, persuading those patients to go with a Medicare replacement policy because those are typically a Medicare C plans, which actually help to cover the co-payments that you would normally run into if you just have A and B. So if you do have Medicare, that's one point I want to really make clear to you, that if you have that 20% unprotected for outpatient, and you also have the deductible for inpatient, that can be really challenging for you. So please think about that. So using your health insurance, once again, be a good consumer. Health insurance is not warm and fuzzy, it's a business. And when you're working with people, it's a dollars and cents enterprise. You have to really think about it. If you're in a situation where it's before you've gotten into a health issue, it's really helpful to really look at, especially if it's an employer-based, or even if you're in the marketplace, if you're buying it individually, looking at what is the right insurance for you. Even with Medicare plans, a Medicare replacement, is it the right insurance for you? And that is a whole range of things that I'm not going to really get into. But Triage Cancer has a really neat checklist on this that I would really suggest you looking at, because it's just kind of looking at, we're trying to predict the future. You're trying to say, okay, here I am right now. What do I need to most worry about if I'm insuring myself today? And when none of us know what comes tomorrow. So we don't have a crystal ball. So you're doing the best you can do, but you try to really at least apply yourself and think about it a little bit, and try to work on a solution that's helpful. With your insurance, really look at in-network providers, using those in-network providers when possible. I've run into this personally where I was seen in a hospital, particularly an emergency room, and then all of a sudden labs or a test was done by the same hospital, which is a network, using an out-of-network provider. In that situation, it was really hard for me to protect myself because I didn't have any power because things were happening very quickly. It was an emergency room. The bills went out. They went within providers that were not in my network. Technically, it's my responsibility to go line by line and make sure that everybody who touches me is actually in network so that the coverage is the best. When things are a little more slowed down, you really do need to ask those questions because it can make a huge difference. And it's an easy thing to say, okay, well, my doctor ordered it and I'm just kind of letting that go. You really can't let that go. You really do need to know, okay, where am I going? Are they in network? What are the numbers? Once again, being a good consumer, this is the business. It's not nice a lot of times. You try to be nice and they try to be nice, but at the same time, you're looking at the financial end that sometimes you may need to voice an objection to make sure that you are staying in network, and you have to kind of watch for that. A big issue that and I've run into this just with my work recently, making sure that your healthcare providers have your up-to-date information. If you've made changes, your insurance, your employer may have changed your insurance, but if you're going to the same provider, did they get that update? That's really kind of your responsibility to make sure that they have the most recent, because what happens so often is you see your provider, all of a sudden they're sending these bills out to your old insurances. They're just going to kick them back. They're not going to explain anything. They're just going to say denied. And then that's basically, you're the only person who's going to get hurt with that, because all of a sudden you'll start getting all these bills, because once the provider gets the denials, they start sending the bill to you. And then all of a sudden you start having the mail pile up. So please make sure that anytime you make any changes, if it's a provider, even if it's a different type of insurance within the same, it's a Blue Cross plan, but it's a different Blue Cross plan now. Some employers each year, they're making changes, and please let your providers know. Pre-authorizations are extremely important. What typically happens is that once a doctor orders something, particularly in our realm, we have a pre-authorization department that actually goes to the insurance and starts to actually look at the pre-auth, and they are the ones who find out the costs. What that also does is it generates with your insurance, it creates an EAB, and I'm trying to remember what an EAB is. It's basically it's an explanation of benefits that tells you potentially online, and your insurance account says, okay, we've been, your hospital or your provider sent this to pre-authorize, and this is the expense, and they explain the benefit and explain what the coverage is. This is another good example that, once you get that pre-authorization, if that doesn't look right financially, start asking questions. Once again, is there a network issue? Is there something that maybe there's an alternative that the insurance would cover more completely and it would still give you adequate care and give the doctor what they need? These are things that are going to cost you. So you really kind of need to look at those pre-authorizations and just to make sure that they're done as well. The other things with insurances is the pre-auth wasn't done correctly, wasn't done completely. And then all of a sudden they're saying, well, we're denying the claim because we didn't pre-authorize it. So that's a big money, big ticket thing to watch. Discussing costs with your health team before treatment. Once again, that I've already kind of talked about that. You find out your doctor orders something, you find out that it's really expensive, that the coverage is really slim with your insurance for that, and you go back and say, hey, I can't afford this copay. Is there something else we could do? That is a very, very reasonable thing to do. We do it every day. Reviewing bills for errors. There are errors that are made in your insurance. Sometimes you have somebody who's coded something in that a claim was sent in from the provider, and they maybe have mixed up and incorrectly put in the billing claim numbers and the codes. And so there's a potential for errors. And if that happens, once again, you're in a situation where you're on the line for the financial end of it. Be you aware? I was talking a little bit about this with the insurance commissioners in each state. try to become aware of just what is the appeal process if a claim is denied by your insurance. And if it's something that the doctor's really feeling strongly about and says, hey, you really need this, they may go to bat for you, but it's really going to be you knowing the appeal process, where to direct any appeal, particularly if the state allows external appeals to the insurance. They may have a mechanism that's there. So check into your state and find out about that just in case you need it. Also, negotiating with healthcare providers. Once again, that's what I was talking about. It's another way to say the same thing I just said, making them aware of what's going on with your insurance, where you might be into problems. Also, keeping track of your out-of-pocket maximum, kind of watching those numbers. Being aware of balance billing, and what balance billing is the insurance basically settles with your provider and says, okay, we're going to pay this. And then all of a sudden that balance billing goes to you, whatever's left in advance over and above of what your provider or your insurance pays, the provider may bill you. So that's another thing to kind of be watching for. And you'll be getting statements about that. And there are other things here that there are things to watch for, but once again, I'm just trying to develop a critical eye for the bills. I'm not going to spend a lot of time on the healthcare insurance marketplace, just to let you know that, insurance is set up in such a way now that if you have a pre-existing condition, if you have all of a sudden a job loss and you're having to get insurance, the healthcare insurance marketplace, they look at that as a special enrollment period. A special enrollment period is the loss of employment. If because of your illness you've lost your job and you've lost your insurance, in the state of Florida, you have the option of COBRA, which tends to be sometimes 3 times the amount of money you were paying for your insurance prior. It's very expensive, but you do have the option of the healthcare insurance marketplace. So that's something to kind of keep in mind if you're in that situation. It's good to know about that. They're also a great resource as far as talking about other programs that might help you to subsidize your insurance. So it's just, once again, that's a good resource if you have that problem. We've got FMLA, Family Medical Leave Act, short-term disability, long-term disability, cancer policies. I have a lot of people that all of a sudden get sick and they don't really quite realize that they did sign up or they actually declined these things within their employer. So these are things, once again, short-term disability is set up. Once you use a certain amount of sick time, you're able to convert over to short-term disability. It can absolutely be a lifesaver. Long-term disability just is something that starts at after that period of short-term, it goes for a long-term. What's interesting is some employers just have long-term, or they may have just have short-term. A lot do have both. A lot of times they'll also make offerings for cancer policies. So these things might be tucked away in your benefits. You may not realize them. So that's something to look for. FMLA is for you or a family member to apply to be off work up to 12. It's for up to 12 weeks. It can be consecutive or it can be here and there, intermittent. But it does protect your job. But once again, we're talking about 12 weeks total. And so that's 3 months. It's not a lengthy period of time. So if it's a shorter illness that you're talking about, FMLA, we call it FMLA or FMLA, it can be very, very useful, but it's something to kind of look at closely, know about it, and actually do a little more research. Once again, it's something I could spend a lot of time on, but I'm not going to be able to. I'm just kind of looking at our time. What I wanted to let you know, I mentioned before, if you have that 80-20 with Medicare, look at the Medicare website, medicare.gov. There are also programs. There's Medicaid, but there are other programs that you may qualify for. They're all income and asset based. There are formulas that are there on medicare.gov. Just be aware, it might be very much worth your while to look at this if all of a sudden you're really having to use your benefits. Social Security disability is something that I'm going to talk about here in just a couple minutes. Also keep in mind, if you're working for an employer, you become sick, you're into a limited situation, you're not able to do quite what you used to do, but you're still functioning fairly well. ADA is the American with Disabilities Act. And believe it or not, there are people when they get sick that some of those provisions may actually help you to allow your employer to make some reasonable accommodations for you to continue working. So if you're in a situation where you're thinking, oh, wow, I don't know if I can keep working and this is a kind of a problem, think really seriously about checking into the ADA provisions. They're all on a federal website, Americans with Disabilities Act. Also want to let you know real quick, Project the Smart. This is kind of a big gun to keep in your back pocket. If you run into a real insurance problem or a real problem with your hospital and a real financial issue, sometimes going and talking to your representative, either your state congressman, your federal congressman, they are set up with a pool of often social workers, but they're people that handle problems from constituents. So this Vote Smart is a good website to go find out who your representative is. It's almost better than going to the media, which I've had some people say, hey, I'm so angry about something my insurance is doing or my provider's doing. I'm just going to go to the media and I'm going to make a lot of big stink about it. And hopefully that'll help me financially. Another big gun is to go to your representatives. So keep that in mind as well. I know I'm getting really close on time. I wanted to explain real quickly, Social Security disability is it's not always quite what it seems. Getting to a Social Security disability, putting in a claim, actually getting it approved. Statistics recently are showing an average of 65% of those claims actually are declined and denied. People, a lot of times when they appeal, are needing to use attorneys or vendors that are second party people. If you do get disability, it's still 2 years before you get Medicare, which is another thing. But if you look at this 1321 for kidneys, adrenal glands, and ureters, I put this on here specifically for renal cancer. It has to be inoperable, unresectable, or recurrent, or with METs to go beyond the regional lymph nodes. So it's kind of like you have to have pretty advanced disease to actually apply for Social Security disability. If you're getting close to 65 or retirement, even if you're between 62 and 65, if you decide to use Social Security disability, go that route and do get it awarded, you will get more money than you would get if you retired at 62 or 65. So there is an incentive to do that, but it's just a matter of kind of looking at that process. Go onto the website, look at the process, and also talk with your physicians about whether they feel that you're disabled also. Sometimes having that conversation is really helpful. I do want to cover this real quickly, and I think that I'll do the next couple categories pretty quickly. Pharmaceutical assistance programs, you'll see them on TV. They'll talk about they'll have an ad for a medication, then they'll say real quickly at the end that there is a manufacturer's program where they may be able to assist you. In this hospital, we're set up, our pharmacy actually has a wing called a specialty pharmacy that when we have a patient that all of a sudden finds out they have a $1,500 a month medication that they require, we actually facilitate a form going to that pharmacy company, that manufacturer's program. We help as a bridge. We facilitate that referral to the pharmaceutical company. What's nice is with our pharmacists, talking to their pharmacists, our success rate is really high. It's something that you can do on your own, but if you do get a huge, all of a sudden you have something pre-authorized, find out that it's that expensive and you can't afford it. Talk to the provider first to see if they have someone who would actually do this for you. It would make it a lot easier. But if not, you'll have to find out all the details, contact the manufacturer, get their form off the website and apply. Definitely do it. They tend to be somewhat generous. I can't say that for everyone, but by and large, there are a lot of them that go through that I'm surprised. And so it's definitely a huge big ticket item that could cost you a lot of money, that could save you a lot of money. This will be something I'll be giving to the website to Scott. These are some of the foundations that are out there that I find have been the most helpful. Particularly you see Triage Cancer on there, not financially, but more for information. But a lot of these, and the other thing is now it's Google function. You're looking at charitable organizations providing funds for cancer patients. Always use, if you're doing a Google search, use cancer patients in there, that you're looking at organizations that provide assistance, because cancer is a specialty area. Doesn't mean that it's renal cancer, any cancer. A lot of them are fairly generic, but they do provide assistance. The one thing you run into with these foundations, though, is they're not providing huge blocks of money. And unfortunately, they don't. They have kind of an ebb and flow to their funding. They get grants. Those grants are exhausted. They get towards the end of their calendar year and they have less funds until the next calendar year. So there's always a flux about what's available. Along with triage cancer, I want to really highlight United Way. Any county that you're in, call 211. It's like 911, 411. 211 is your social service directory that helps you identify any local organizations or programs that may help you that are subsidized. So it's a great clearinghouse that most social service agencies will post with 211. It's actually administered by the United Way. They will help you to identify any local places. Copay relief programs, I put down on there for myself, but actually all the charitable organizations, most of them do copay relief amongst other things. So I'm going to kind of leave that. And the last thing I wanted to just cover real quickly is there are people who do fundraising when they run into financial issues. I found a lot of people who didn't have insurance, and sometimes, I hate to say this, they sort of had principled reasons for not wanting to get insured, or they didn't want to use the marketplace. They had a lot of principled reasons for not doing it, so they decided to do crowdfunding and they go to GoFundMe. If you look at the bottom, GoFundMe has really reported that about 90% of medical crowdfunding that they've administered have failed to reach their goal. So the results are a little mixed on how effective that is. So it's something to kind of keep an eye about. It's always maybe worth trying, but you might really, it's not, it's not always a surefire thing. So I know I have gone through a lot of things. I know I came in just a little bit over time. Does anyone have a specific question? I know I just went through an enormous amount of information, and I'm sorry about that.
It was all great information. No apology necessary.
Oh, thanks.
I think that if anyone missed any part of this presentation or would like to review any of this information that was presented today, we will be putting this on our website and social media on Monday, along with all of the slides. So you can tune in then for that. Colleen says, thank you, Mark. And thank you, Colleen, for joining us. So yes, if anyone does have any questions, you can type those into the chat now and we'll make sure that those get answered. And in the meantime, while we're waiting for some questions to come in, let me share my screen here and just give you all a heads up of what's coming. Next month.
Stop sharing, or did you already kick me off? Okay, good.
Oh, I didn't kick you off. It just, I wanted to share my screen real quickly
Sure.
so that we could talk about next month's kidney cancer conversation. So if anyone we have a kidney cancer survivor next month that will be talking about stage 4 renal cell carcinoma diagnosis and how he dealt with it, and perhaps some of his coping mechanisms. There's something that will help you as well. So if you have any interest, you can sign up on our website now. So Mark, a lot of times our questions come in after the fact through social media and through the comments on YouTube and things like that. So would it be all right if we reach out to you next week to get any of those questions answered?
Absolutely. Absolutely. Yeah, I was going to suggest that. Absolutely. So yeah, I'm definitely available. You have my email and we can communicate those questions and I'll do the best I can.
Wonderful. Well, thank you so much for sharing your expertise with us today, Mark. I think it was very informative, lots of information. This is something that I think people could get multiple viewings out of and still pick things up. So thank you so much. And thank you all for joining us. And let's see, we got one more thing here. Oh, here we go. Rosemary says, thank you, Mark, for this great presentation and resources, I just wanted to share that the Kidney Cancer Association has a financial assistance program and approved applications up to $250. My name is Rosemary, and I serve as a patient liaison there. Thank you very much for that information,
Thanks.
Rosemary.
Absolutely. I'll add that to my list. Thank you.
All right, everyone. Well, that's it for today. I hope to see you all next month. Let's see, Robin says, I just want to thank you for your time and information. And I want to warn people, to be certain to check if they have been admitted to a hospital or if they're on a hold status. And then Kathy, what are the chances of getting approved for SSD if a person has Mets to the lungs, but they are slow growing and small and no treatment has been done, only surveillance? Must a person be having a lot of symptoms?
I would say she probably has a good shot of getting an award of Social Security disability. The Mets is the key thing. Even though I'm glad they have it slowed down and it's going slow, but still just the fact that Mets does change it. And that does, yeah, I would say that it's very likely she would get approved for that. Keep in mind, one thing I didn't have a chance to talk about, what Social Security disability does is you apply, and then what they do is they actually get the names of all of your providers and the contact information, and they get releases of information from you. You'll get a packet. They will then send those releases to your physicians. So they're not asking for all the medical information from you. They're soliciting all of your physicians. Everyone you list, they're going after your medical records. Then they make a determination. That's one good reason it's good to maybe talk to your physician to honestly see how they're charting right now, how each visit they see you, what they're putting into your chart, because Social Security is going to go after those. And they're not sending you a form or sending a provider a form to say, hey, fill this out, Dr. Smith. They want his records. So I hope that helps.
Absolutely. Kirk says, thank you so much for the great information. And Kathy says, my relatives encourage me to try, but I don't feel disabled, only tired. And she also says, thank you. And Kathy, everybody needs help sometimes, and there's nothing wrong with asking for help. Okay. And it's not a permanent, it may not be a permanent thing, but don't feel bad about reaching out for help.
We're social animals. Sometimes just talking to the right person just helps you to kind of get things collected for yourself. I mean, we're social animals. Nobody can do it all by themselves for themselves. We need each other. Well
said. All right. Thanks, everybody. That's it for today. I appreciate you, and you'll have a great day. Thanks, Mark.
Thanks, Scott. Thanks, everyone.